Hi, it's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered, and in last week's episode, I answered another question in this series of questions from my client Melissa, and the question last week was part 7 of my 78-year-old mom has lung cancer and developed an infection. She's in ICU on the breathing tube. Can she get off it or will she need a tracheostomy? You can check out last week's episode by clicking on the link below this video. In this week's episode of Your Questions Answered, I want to answer the next question in this series of questions from one of my clients, Melissa, which are excerpts from phone and email counseling and consulting sessions with me. And the question this week is, my 78-year-old mom has lung cancer and developed an infection. She's in ICU on the breathing tube. Can she get off it or will she need a tracheostomy? And that's part 8 of this series of questions. And you can also find previous questions answered from Melissa, part 1 to part 7, if you're clicking on the links below this video in the written version of this blog. And if you are watching this on YouTube, go and click on the link below this video. That'll get you to our website where you find the written version of this blog. So after I started counseling and consulting Melissa earlier this year, her mum eventually left hospital after going from intensive care to long-term acute care, and she went home eventually. A few months later, her mum presented back to hospital and got readmitted back to intensive care because of the lung cancer having come back again. At this stage, the ICU team is adamant that Melissa's mum hasn't got much time left and that she will die very soon in the next few days. They have suggested hospice, and Melissa is having second thoughts about what else could be done. So I actually showcase the dialogue between Melissa and myself below, so you can actually read how I can steer the conversation in a direction to help Melissa to come to terms with the situation and how she can make sure that she looks at the situation from many angles so that she can actually do what's best for her mum. The reality is that when patients die in intensive care, the sooner you can embrace the inevitable and the sooner you are in a position to talk to your loved one about it, the sooner you can make peace with the situation as is showcased in the dialogue. So go and click on the link below this video if you're watching this on YouTube, or just scroll down and read the dialogue between Melissa and myself and how I can help her and her family to come to terms with things and how I can help her to make sure her mum gets the best care and treatment. Also, go and look out for the next episode of this series of questions answered, where I continue the conversation with Melissa and help her to come to terms with what's happening with her mum. So, how can you become the best advocate for your critically ill loved one? How can you make informed decisions, get peace of mind, control, power, and influence quickly whilst your loved one is critically ill in intensive care? You get to that all-important feeling of making informed decisions, get peace of mind, control, power, and influence when you download your free instant impact report now by entering your email below. In your free instant impact report, you learn quickly how to make informed decisions, get peace of mind, real power and real control, and how you can influence decision-making fast whilst your loved one is critically ill in intensive care. Your free instant impact report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free instant impact report now by entering your email below. In your free instant impact report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions, discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests, how to eliminate fear, frustration, stress, struggle, and vulnerability, even if your loved one is dying. You get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power, and influence in your situation. You'll get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You'll get crucial behind-the-scenes insight so that you know and understand what's really happening in intensive care and how you need to manage doctors and nurses in intensive care. And it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I'll see you again next week in another update. Make sure you also check out our blog section for more tips and strategies, or simply send me an email to support@intensivecarehotline.com with your questions. Or you can call me, find international phone numbers on our contacts tab on the top of the website. Also, check out our ebook section where you get more ebooks, videos and audio recordings, and where you can also get one-on-one counseling and consulting with me via Skype, over the phone, or via email by clicking on the products tab. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.